my name is Madison. I will be your healthcare provider today. Today I'm going to walk you through what to expect during a pelvic exam. A pelvic exam is an important part of preventative healthcare. It allows us to check the health of your reproductive organs and identify concerns like infections, abnormal bleeding, or early signs of cervical cancer. Cervical cancer screening with a Pap test typically begins at age 21 and is done at recommended intervals depending on your age and health history. The goal here is early detection and prevention. So before we begin, I want to go through what you may experience during this exam. You may feel pressure during parts of the exam, but it should not be painful. If you ever feel discomfort, please tell me right away. We can pause at any time. You are always in control. Before starting the exam, I will wash my hands. You will be given some privacy to change into a gown, and then a drape will also be placed over your lower body to maintain your privacy. When it is time for the exam, you will lie back on the table. For the pelvic portion, you will move so your bottom is at the edge of the table, really far close to the edge. Your knees will be bent and your feet will be supported. I will lift the gown while keeping the drape in place so that only the area that is being examined is exposed. First, I will perform a visual external inspection. This means I'm just gently looking at the outside of the genital area. I'm checking for redness, irritation, any sores or swelling. You shouldn't feel any pain during this part. I may then warm my hands and I'll gently press on your lower abdomen to check for tenderness or masses. I will also check the lymph nodes in your groin area, so I will be touching down there at this time. Next is the speculum exam. This is what the speculum looks like. It's a smooth instrument. It's gently inserted into the vagina with lubrication so that I can visualize your cervix. You may feel pressure or stretching as it is inserted. You can try to take some slow, deep breaths as this can help your muscles relax. This also may stimulate the vagina to produce some of its own fluid and lubrication. This is completely normal during this exam. It should not be anything to worry about. It shouldn't be painful. If it is, again, please tell me right away. If you're due for a cervical cancer screening, I'll perform a Pap test. This involves a small, soft brush to collect a few cells from your cervix. You may feel a brief brushing sensation or scraping or maybe some mild cramping, but it should only last a few seconds. This screening helps to detect early cell changes that could lead to cervical cancer. Once finished, the speculum will be gently removed. The final step is called the bimanual exam. I will place 2 gloved fingers inside the vagina while gently pressing on your lower abdomen with my other hand. This is going to allow me to feel the size and position of your uterus and ovaries, and I can check for tenderness or any masses. Here is a visualization of the female reproductive organs with the ovaries here, the uterus is here, and the cervix is at the bottom of the uterus inside the vagina. You may feel pressure, but again, this should not be painful. Throughout the entire exam, I will be checking in with you to make sure you're feeling all right. You can ask questions, request to pause, or stop the exam at any time. I'll be letting you know what I'm doing or what I'm about to do before I'm doing it. And it's completely normal to feel nervous or embarrassed or unsure about this exam. A lot of patients worry about discomfort or feeling exposed. Please know that this is a routine medical procedure. Your dignity, privacy, and comfort are always my priority. If something feels uncomfortable, please let me know right away. Communication is key. You are always in control of your own body and your own care. So if you have any questions, just let me know now.